situation over the next few weeks will deteriorate. Let's be clear about that. And that's the reason just before, a couple of days before Christmas, I'm being very clear. The situation over those two key things, COVID and influenza, will not improve.
Quebec's health minister there during the holiday season. If you're a Quebecer frustrated by what you just heard, a new survey from the Angus Reid Institute shows you're not alone. It measures the percentage of the public who says the government is doing a good or very good job in handling healthcare and found a substantial drop from the pandemic. On average, 49% of those surveyed across provinces in 2020 said their provincial government was doing a good or very good job. In 2023, that number sank to just 24%. Some of the biggest drops in satisfaction, BC went from 63 to 27%, New Brunswick from 42 to 11%, Ontario from 47 to 19%, and Newfoundland and Labrador down from 48% to 20%. Let's bring in the front bench to unpack those numbers. With me this evening, former New Brunswick Liberal Premier Brian Gallant. He's now the CEO of Space Canada. Former Conservative Deputy Leader Lisa Raitt. She's the Vice Chair and Managing Director of Global Investment Banking at CIBC. CTV News political analyst and former NDP leader Tom Mulcair is here, and so is the Toronto Star's Queen's Park Bureau Chief Rob Benzie. Hi, everybody. Good to see you. Again, Happy New Year to everyone. Tom, I'll start with you because you're in Quebec. I know we're focused on Quebec because they had a pretty dire ER situation, but Ontario and other provinces are dealing with a very similar healthcare situation. How much of this is a reflection of kind of the faith that governments had during the pandemic and what's happened since?
I think that that's the exact key here. Everybody rallied around their governments at the time of the pandemic. It wasn't the time to start nitpicking and criticizing and finger pointing. Everybody was in this together, and we had to do our best. And governments were given credit for doing their best. I think that that's the the upshot of it. But right now in Quebec, we are on our sixth major healthcare reform in the last 40 years. And we're going to replace everything that's existed for only 5 or 6 years this time out with a new agency. And that's the Hail Mary pass that's supposed to solve all the problems. Of course it won't, because the basic problem is we don't have enough money to pay the nurses and we don't have enough doctors to provide the services, and the system itself is broken. And I know that sounds like the theme of one of the parties vying in the next federal election, but the healthcare system across Canada is in desperate need of a fix. And Quebec is no different, and it's showing up in the polls. And I think that there's a surliness in the population, Vassy, that's showing up. These are healthcare numbers, but generally, if you look at François Legault riding high in the polls a year ago, Doug Ford came out of the pandemic really doing well. Blaine Higgs, go down the list. And even in Saskatchewan, where Scott Moe was just sort of like untouchable, they're up to stunts now to try to get some attention and saying, well, if we have to go to jail, then that's what we'll do. And this is where we are in Canadian politics right now. I think that it's the aftershock of the pandemic, and everybody's coming back down to earth. And I do think that the pendulum will come back to the middle at some point. It's swung pretty hard the other way after the pandemic. And I think we're going to get back to something resembling normal in relatively short order.
What's your sense of that, Rob? You're at the legislature in Ontario every day. I think, I live in Ontario as well. There are tons of kids waiting 8 hours in hospitals. Like the cost of living remains a very dominant concern, but healthcare was what people were talking about a lot over the holidays as well.
Well, exactly, Vassy. In Ontario, as in the rest of Canada, people have a tough time finding a family doctor. That's a persistent concern. But I think Tom's right. I would say that the Canadians are cranky. They're surly and they're cranky, and I think this is manifesting itself in this poll. We saw yesterday from Polara a poll that 82% of Canadians think that we're in recession, and we're technically not in a recession, but everyone is feeling the pinch with affordability. And I guess when you ask them about healthcare, they're like, yeah, and I'm ticked off that I can't find a doctor. I'm ticked off that there's a lineup for this service or that service. And I think that's a general kind of a feeling. And this is why it's good to be in opposition right now. And that's presumably why the federal Conservative leader is in a good mood and is doing well in the polls, and why some incumbents, like the Prime Minister, are perhaps concerned about facing voters in the imminent future.
What do you think the implications of that, Brian, are particularly for incumbent governments? I mean, I guess it's a bit ironic, but New Brunswick saw one of the worst, decreases we pointed out in the introduction. What are the lessons learned? If we are cranky and surly, as Tom and Rob pointed out, what would you take away from that as an incumbent?
Well, let's go back to when the pandemic hit and everybody was trying to sort of, as Tom said, rally around their governments. I think it goes to the kind of the old adage of politics: when you have an emergency, a government is either going to pass or fail. And if they pass, meaning that they're doing a good job in dealing with whatever the emergency is in question, then they're going to see a surge in the polls. And if they fail, then they're going to see their numbers drop hard. So in Canada, governments fared relatively well. I think people were satisfied, so they got the pass mark. So most governments, if not all of them, saw a big sort of surge of support during the pandemic. And as was mentioned, of course, maybe people are a little sort of after that pandemic, after all the sort of consequences of that in all directions, are not in the best mood. But on top of that, I mean, it was obviously a big strain on healthcare. So it's normal that the system that was already having a tough time and already had challenges is all that much more sort of strained. So when you take all that, you now face, as Rob was mentioning, you face an electorate that is very worried about cost of living. They're irritated with healthcare, if maybe that's not maybe even a strong enough word. And for provincial governments, obviously healthcare being its jurisdiction, I do think that they have to be very, very aware that this could be huge issues for them politically speaking. Again, another adage in kind of provincial politics: you can easily lose an election on healthcare. Hard to win one on healthcare, though, is the old adage, right? So, but you can definitely lose one. So I think when you're trying to deal with the cost of living, which is the sort of number one priority for most provinces, and healthcare right in second, I mean, those are two very difficult challenges to be fighting at the same time.
I guess I wonder, Lisa, what the wider implications are of a electorate that really feels like on the two biggest things that matter most to them, they're in a bad mood, as everyone says, right? Or that they are frustrated and they feel like their concerns are not being addressed. Like, if that is a predominant sense or sentiment among the electorate, what is the potential impact of that?
So I don't think they're being grumpy for grumpy's sake. I think they're having personal experiences or hearing about it through very close personal experiences of something that's actually happening out there. I really think that politicians have to get out in front of this and start talking about really the big issues of why this is happening. Is it population growth? Is it the fact that there's a change in how primary care physicians work? Is it because there's not enough primary care physicians? Should we have more clinics? There's lots of reasons why this is happening, but you can't deny the fact that we are hurtling towards a period of time when the demographic in this country fundamentally changes and we become a lot of people over the age of 60, 65, and the pressure on the system is just going to get worse. This is not getting any better. And if they're experiencing these low numbers right now, hold on to your hats, kids, because it's going to get far worse. I've had a very real relationship with the healthcare system since 2016. I can tell you it's very different now than it was. I don't know if COVID caused it or if it's just the fact that we haven't kept up with the investment we needed to do over the time period. But it's a real issue. And I appreciate the terminology that Canadians are grumpy. I would submit that they're desperate, that they're terrified, that they're fearful, and that they're beginning to lose trust in the government as to whether or not their health care is going to be there when they need it.
Yeah, and those numbers from Angus Reid are certainly emblematic of that.